Hi, so in the next video, I would log in as a lab staff who has just received orders for, the patient Tina's investigations. So remember that Dr. Johnny just sent out a request for lab tests. When I click on the notification bell, you can see that there are some notifications here to follow. Okay, there's a notification for pharmacy, there's a notification for the laboratory. So you go to lab, go to view lab orders. View lab orders simply means that you're going to view all orders that were sent from the clinic by the doctor to carry out on the patient. Let's say for the patient Tina, the doctor sent out request for PCV, malaria, typhoid, and for wider and for malaria, typhoid, and yeah, I've forgotten, but we'll find out. So I'll click on, you can see a list of lab orders that have been sent over time. Some of these are still here because they weren't processed. Maybe the patient did not, follow up with, coming to do the test and all. So I'm going to click on this, and you can see the tests in detail: malaria, parasites, PCV, and wider. So let's build this. That's why it's called bill lab order, because you are supposed to bill these services. So let's say we are billing for malaria parasites. Malaria parasites, definitely not 100 naira. So let's say malaria parasites 1,200. I'll add. We're also billing for, okay, we'll just build for that. Let me save. We're also going to bill for PCV. Okay, so we have PCV here. There's no price. Okay, PCV 1,050 naira, and I'll click on done, and then let's bill for wider. So now you remember that I spoke about some services are not on the lists. So sometimes you would not be able to search for a service because it has not been added to the service list, or maybe if it's a product, that means the product is you're out of stock. You cannot search for products that are out of stock. You cannot search for a service that you've not added to your list of services. One way to do that is to click on this. There's a prompt now telling you that wider is not on our service list. So I'll add wider quickly. Wider, and let me just add that, and the category is lab investigation. This is just me doing a quick fix. This is so it's going to be billed by cash. So let's say wider is 1,300 naira. I'll add this and create. So now we have wider in our list of services. Let's attempt to bill wider again. Now we have wider for 1,300 naira. Let's say we want to give this patient a discount because maybe we have a rule that if you do up to 3 services, you get a discount on the third. So if I click on adjust, you can only adjust a price if you've been given the privilege to do so. So I'll click on adjust, and I'll change this to 1,200. What I've just done here is change the price of wider for this patient only. It does not change the price of wider in our service price list. As you can see, the selling price remains 1,300, but this patient has been given a discount of 100 naira. I'll click on done, and voila, we've just built this patient for these tests. So we can now go over to the lab result to start documenting the results as the case may be. So we have 3 reports to document for this patient. Let's say we've done the malaria parasite test. I think that should be hematology. I'm not sure. Don't know. Okay, I don't know where I would find malaria tests. So I'll just use a generic form to report this. I'll say, okay, malaria tests 3 plus plus treats immediately. Sorry, this is just me trying to, demonstrate something. And I'll set this at final and I will save. So I've just reported malaria test. If you check his status, this will change from pending to final. That means that the report has been completed, although the billing is yet unpaid. So we normally allow you to start reporting a lab report even whilst the bills have not been paid or has been paid in parts. So it depends on your workflow. If you insist that a patient must make payments before the report starts to move, it's fine. It's still it's left for the users to implement whatever works for them. So let's report PCV. Again, I don't know where PCV falls under. Okay, yeah, got this. So let's say her patient PCV is 42, which is normal. I'll save this as final. And I've reported PCV. And for WIDAL, I think WIDAL is serology. I'm not sure. WIDAL. I think I've seen WIDAL somewhere before. Microbiology, right? Okay. I don't know where I can find WIDAL, but what I can do is take us to a generic form where we can report WIDAL investigation. So I can say not present, patient is fine, and I'll save as final. So what I've just done in the lab is report, report everything that, for all the investigation requests that were sent for Tina, and the patient is good to go back to the doctor. So I'll log out, from the system as a lab investigation or a lab staff. So let me now log in as, the pharmacy. So at this point, the patient has gone to pharmacy to get her drug. Remember, like I said, so in the workflow for this demo, the patient can access all services and then proceed to go and get a bill and pay for it. So remember, just like in laboratory, we have a prescription sent. This is, there's a prescription sent for morphine. So here we don't have, I'm sure we have morphine in, let me change the location I'll change the location to main pharmacy. So your location will determine what you have. Let me see. So for me to be sure of what we have in stock, I need to go to store inventory. That's as a pharmacist now. So the fact that you're not seeing, so it depends on how many locations you're managing currently at the hospital. So there's no morphine here in this pharmacy. I think we should have morphine in one of these. There's no morphine here. IPD, no morphine. There's no record. ONG. Let me go to main store. So there's no morphine here. Oh, fine. So we have morphine here in the GOPD pharmacy. So I can now bill for morphine. So it's important that you're in the right location to be able to bill, what you have in stock. So let me say morphine. I know that I have morphine. I just saw, okay, fine. So I have morphine, although there's no price for morphine. So I'm going to add a price. So let's say morphine costs 2,000 naira for one vial. So I'm going to add that. I'm supposed to be changing the price. Okay. So yeah, just succeeded in billing this patient for morphine. Now the patient has just been billed for morphine. The next step is to go to the nursing station that's to nurse TT to have this injection, what they call, administered. Nurse TT again will go back to appointment, click on Tina, out attend to client, and go to medications. You can see that there's already a planned medication, which is morphine for this patient. So you can enter a new comment. You can say to next at 6 p.m. So the next one will be administered at 6 p.m. Click on action, administer, and click on continue, after the prompts. And that is to say that we've just administered, morphine 2 milligram at 12, and the next one will be at 6 p.m. This is the time or the date it was administered. You can also, view the history. If you have, as you keep administering, there might be a history. You can see the time ordered 12 minutes ago and details about this administration. You can also discontinue or drop. I wouldn't do that because we're trying to demonstrate something, but you can drop a drug or you can discontinue a drug. So the nurse can go back now to Dr. Johnny, to continue her encounter. So let me log in once again as Dr. Johnny. Dr. Johnny, Tina is now back with Dr. Johnny. Dr. Johnny would now go through the reports from the lab. I forgot to, okay, I'll just show us briefly how we respond to radiology requests. So let's say the prescription has been administered. Dr. Johnny can see that, by clicking on this, this that was updated 1 minute ago. Oh, I'm having a bit of network situation. So you can see the reports from the lab, or here you can see details about the drug that was just administered some minutes ago. That's 2 minutes ago. You can also see the lab results 6 minutes ago. Dr. Johnny can be able to make inferences, based on data from the lab investigation and so on and so forth. This is how you attend to a patient through as regards the client's journey in the hospital using Health Stack. The doctor might decide that this patient should be on admission. What the doctor needs to do is click on action, go to end encounter, and click on admit to ward. This is to say that, okay, I think this patient should be admitted. We'll send this patient to the general ward. Please put on normal saline. Okay, that's just an instruction. I'll submit this admission order. So Dr. Johnny thinks that this patient should be on admission, and I've just sent a request. You can see admission order. As you can see, we are building a history for this patient at this hospital. Let me log out and have nurse TT admit this patient or process the admission request for the patient Tina, which is the final part of this demonstration. Remember that nurse TT is assigned to theater and to ward. If I click on ward, yes, okay, nurse TT does not have access to this ward, so I need to give nurse TT access to this ward. I'll just quickly do that as an admin. Just give me a minute. Let me add nurse TT, give nurse TT access to Word. Okay. All right. So we've kind of fixed that issue of access to certain locations. So this might happen. Sometimes you might not be able to access a certain location. Do not panic. Just know that it's something that the admin in your hospital should be able to, fix, without breaking a sweat. When they set up your user accounts, they're supposed to assign you to different modules and different locations. If you go to a module and you are being told that you do not have access to that location, just know that it's because you've not been assigned, that location, and that can be fixed if you go to your clinic's admin. So I have to log in. Let me just use, okay, no. So let me use this, no. So this is not TT trying to process. So this is much better. The request for admission for the patient Tina, you can see we are not in the right. Tina was sent to general ward, so change location to general ward. And you can see, okay, all other admissions that were pending that were never processed. Tina, okay. If I click on this request, I can see the instruction given here. Please put on normal saline, okay. So I'll choose the bed that I want to place. Let me say bed 2 is available, and I'll click on admit to assign patient Tina to bed 2. Patient Tina is now an inpatient at the hospital. To manage patient Tina further, you need to click on inpatient. This is inpatient to continue managing patient Tina. If you click on, you can see patient Tina is on bed 2. This is her name, gender, 9 seconds ago she was admitted, her tag. If you click on patient Tina, the doctor can continue to document, do all other documentations that they need to do concerning Tina. So we're trying to, so I'm going to allow this. So this is me trying to take care of patient Tina as an inpatient. I'm just trying to demonstrate the speech feature for our patient documentation. I'll stop this. Yes. Patient Tina. It could be anything. Again, this is just me, So this is patient Tina, an inpatient, still under the care and management of Testes Hospital. So you can still send patient Tina for more, tests and, the likes. Remember, we sent out a request for laboratory, right, for radiology. So to manage that, whoever it is that is the lab technique, the diagnostic or the imaging technician, we just click on bill lab or bill orders for radiology. The same thing we do for laboratory and prescription. You can see this here. You bill this order. So remember, we're billing for chest x-ray. Okay, and we add this and you click done. So we've just billed this. Now the patient you can now start reporting that chest x-ray. You can see all other chest x-rays, requests here. Some of them are final, some of them are pending. The ones that are pending, it means that it has not been completed, they've not reported. The ones that are final, you can tell that, okay, that has been reported. Let me click a final report so that we can see how that looks. This is just a demo account, remember. That is why we're seeing what we're seeing, not a lot of details. So let me report Tina's request. Let me say this is chest x-ray. Nothing in the chest. Everything is fine. The techniques, let me say I used 2 papers. Yeah, beg your pardon. Comparison, none. Everything is fine. What am I finding? Chest is okay. Needs to breathe more. Need to breathe more. And what's the impression? There's no none really. Recommendation, none. Try a Mantos test rather. So let's say if you're suspecting TB, then try sending this patient for Mantos test because we can't find anything in the chest. So I'll just save this as final. What we've done is we've reported that everything is fine with the patient in her chest, and there's no need for there's no chest issues at all coming from the radiology office. So, I think Dr. Johnny, okay, this is not TT, still logged in. The result just dropped. And yeah, so yeah, so basically, let me just do a quick recap. So we registered a patient. I also showed her how we can um, how we can find a returning patient, schedule an appointment, have the patient see a nurse, see a doctor, and do all of the lab investigations, radiology investigation, reporting, and basically that is how the patient's journey moves. Thank you. Hi. In this video, I'm going to continue from where we stopped in the last video, patient journey, to show you how you can process payments after bills have been collected, throughout the patient's journey in the hospital. I'll log in as the front desk person, assuming that the front desk person, handles, payment processing. So I'm going to go to finance. Remember, we are dealing with a patient called Tina. You can bill a patient by going to bill services here, and you will find a list of all unpaid bills here, or you can simply create a new bill using this form. But for the sake of this demonstration, I'll just go straight up to payment, because as you know, we've already billed the patient at different times for registration, consultation, um, lab tests, radiology investigations, and for morphine, that's for medication. So let's go straight up to processing payment for those bills. As you can see, the patient we're dealing with is Tina Nick. Tina Nick has a bill of over 12,450 naira. Ways to manage this bill: either you click on the bill and you can see in detail all of the services in that bill. You can check the ones you want to print an invoice for. You choose the account you want the patient to pay into using the invoice, or you can just change this to a different account. Let's say we're not sending out an invoice. Let's say we are processing this payment right away. You can just click on make payment, and that takes you straight up to the payments page. Or another way you can get there is simply clicking on pay, and it takes you straight up to the payments page. You can see the total amount due is 12,450 naira. There's no balance right now. The patient has not dropped any money as we speak. So this patient is paying for chest x-ray 5,000 naira, prescription 2,000, lab malaria, typhoid, PCV registration, yeah, as the case may be. Okay, so you might want to, the patient might be willing to, might be offering to make part payment for individual services, or they are making part payment of the whole lump sum part. They enter the amount, or they are making, full, like complete payments, as the case may be. So let me demonstrate using 10,000 naira. So let's say this patient is making a deposit of 10,000 naira, and they are doing so with, let's say, First Bank, USSD. So that's bank transfer. So we're going to accept. This is us saying that, okay, the patient paid 10,000 naira bank by bank transfer. The mode of payment is bank transfer. So I'll accept. You can see that the current balance has changed from 0 to 10,000 naira. That means that the patient is not paying in full, it's just going to be paying part of 12,000 naira. So we enter the amount in parts. So we're paying 10,000 naira, and I click on pay. When I click on pay, you say payment successful. What that means is that we successfully made part payment of 10,000 naira. So this patient has a balance of 2,450,000 naira whilst they're still on admission. That payment, can be paid before the patient leaves the hospital or as they accumulate more bills. So that is how we process a patient's bill or payments on the HealthStack platform.